to those patients. So, nasabtan ang graph, the difference. Kaning isa, again, kani, one phase lang, no? Pag inom nimo, nag-release na ng tambal para maabot sa ana. Okay? Kani, duha ka phase. Na atay immediate release, na din tayo sustained or delayed release. Okay? So these are the advantages of your extended release dosage form over conventional forms, no? So on your book, nakabulisa diri ang mga advantages. Again, first, less fluctuation in drug blood level. So, osip meaning sa fluctuation. Kani ba kani fluctuation. So, pag mag-inom magud ka, di ba dapat 2 times a day ana para masaka siya. Kung mag-fluctuate ka ni magsigsaka, inom na pug ka na pug another dose na ana na pud. So nakay na miss nga dose. Again, nakay na miss kay imo manggikuan kanang so nalimot man ka na ay fluctuation of blood level. Then frequency reduction in dosing, enhanced convenience and compliance, reduction in adverse side effects, and reduction in overall healthcare cost. Okay? Pero, reality is, mas mahal ni sila nga mga dosage form than those conventional. Okay? So, na siya mga advantage, no? Yes, it's true nga advantages sila. Pero, makaingon kang advantage sila sa maka-afford. Pero kung dili gyapon ka afford na kay most kanang sometimes magud ang presyo sa isa ka modified release dosage form kay equivalent siya sa 5 or unom ka tablet na kuan, unom ka tablet na conventional unya. Kung mag-inom kang conventional 3 times, for example, 3 times a day lang. Dayon tag 5 isa, so maggasto lang kag 15. Pero kung dito ka sa modified release times 5 times 6 ang presyo. Okay? So, mag-ingon na po sila nga, dili lang ko anak kay, when you have a patient manggod, you have to explain to them that they have the option. Okay? Kay dili man nimo pwede ipilit. For example, wala gid sila kwarta. No? So, it's, nanana sa ilaha kung magtuman sila nga ma-good compliance ilahang medication regimen or mo opt sila og kaning inani once a day dosing lang para convenience sa ilaha. So dili man nimo na mapugos sa everybody kay lahi-lahi man tag situation, no? So pero imong i-explain sa ilaha nga mo ning advantages, mo ni ang disadvantages. Okay? So there are terminologies, no? There are terminologies that described here. The modified release, the extended release, the delayed release, the repeat action, and targeted release. So these are the different modified release. Modified siya kay it is not a conventional. Gi-modify iyahang immediate, wala na siya immediate release. Okay, so when you say modified release, this drug release based on time, course, and location. So designed to accomplish therapeutic or convenience objectives. Okay? So, kaning mga ER, kanang extended release, delayed release, targeted release, so they are all form of modified release dosage form. Again, this immediate release, delayed release, repeat action, targeted release, they are example or form of a modified release. So when we say extended release, they allows reduction in dosing frequency. Ito yung ganina, instead na 3 times a day, 4 times a day, gihimo na lang once a day dosing. Kaya naaman siya sustained release, no? Na siya extended na release. Then success, when we formulate extended release dosage form, we can say that it is successful, no? This nakahimo ko drug kanang extended release dosage form successful yun ni makaingon tingin ana if the release of the medication is at a predetermined rate. For example, katong ingon nga every 1 hour mag-release siya og 100 milligrams para ma-maintain niya ang katong concentration nga dapat niya i-maintain. Okay? And then they must dissolve in the GI fluids, of course, kay mga oral medication man ni moagi man sa GIT. So dapat imuhang tambal ma-dissolve siya sa gastrointestinal fluids, either sa stomach or sa antisyntong ahaman nimo siya intended nga ipa-release iyahang medication. Then, maintain that sufficient gastrointestinal residence time. Dapat, na siya residence time, meaning, dapat 24 hours lang siya taman, mahurot na niya ang katong sulod sa iyang tambal. Okay? Dapat 24 hours kay kung dili na magsige na to saka, ma-reach na po niya ang toxicity, the toxic level. Okay? Then absorb at a rate that will replace the amount of drug being metabolized and excreted. Then the delayed release, this release drug at a time other than promptly after administration. They are time-based or based on the influence of environmental condition. Very gasgas na example, ang enteric-coated tablets. Now, they have the delayed release. Delayed siya kay once you administer the enteric-coated, dili man siya agad mo-release sa iyahang medication sa stomach. No? Kay iyahang coating, no? Designed na ma-dissolve sa intestine. So, maghulat pa ka og pila ka oras. So, maghulat pa ka og pila ka oras maabot ang imuhang tambal sa intestine para dito siya mag-release sa iyang medication. Okay? So, naay mga different body system, I mean, different gastrointestinal tract, no? Sa kanang imong tract din ha, lahi-lahi sila transit time. For example, sa stomach, magstay lang imuhang pagkaon diya or anything you ingested 2 hours lang yun na siya. After that, no, munaog na po na siya sa imuhang intestine. Then sa intestine, mga 4 to pila ka oras na po siya, butang to 4 to 24 hours, then munaog na po siya sa imong colon. So, inana, dapat ang imuhang tambal, kung dito siya sa intestine, for example, dito siya sa intestine mo gikuan, intended, no, intended na mag-release, dapat within that time frame, no, sa imuhang intestine, naala ang tambal, dili kay mawala siya dito sa sulod, natunaw na siya, wala pa nag-transit. Okay, unsaon niya pagkuan, unsaon niya pag-release sa tambal. Okay? Then, repeat action contains 2 single dose medication. Ang isa is for immediate, ang isa is for delayed. Ito ko na-explain ganina. And then the targeted release directed toward isolating or concentrating a drug in the body region, tissue, or for absorption of or for drug action. So when we say we will focus here to modify release, the extended and then the delayed. Okay, the extended release oral dosage form, modified dissolution, no? Modified drug dissolution. So they contain a barrier coating. So again, ang kanimo mga extended release dosage form, naa sila dissolution nga modification sa ilahang kanang sa tunga na coats. Naa sila mga coat. Ang kaning tablet coat niya, they can control the access of biological fluids. And also, nasa like controlled drug diffusion rate from the dosage form. Kaya again, they are not intended to release the medication immediately. Dapat na i-control. And then chemical reaction or interaction between the drug substance or its pharmaceutical barrier and site-specific biological fluid. So there are examples of what type of barrier coating, no, can be used para na ay extended release. The coated beads, the granules, and then the microspheres, no? These coated beads, granules, and microspheres, they are small inert non-parallel seed or bead, no? They are made up of sugar and starch. And again, these coats, no? These coats affects the rate at which a drug release from the dosage form, and then they slows the transit time through the GIT. So this is an example of your inert non-parallel seed of beads or the microcrystalline crystalline cellulose na spheres. So your inert non-parallel ng 425 to 850 millimeters sila kadagko. Again, kani ang ginagamit nga coating para na ay controlled release ang imuhang tambal. And then the microcrystalline, they are more durable during production than sugar-based pores. Ang sugar-based katong inert non-parallel seed or bead. Okay? Another technology or another method para na ay modified release is your multi-tablet system. Okay? Kasi nakakita na inana ang nga kuan, inani nga in aning capsule sa kuan sa market. Nga mo na siya capsule pero beads ang mga sulod or mga pellets. No, they are multi-tablet system, no. They have extended release oral dosage forms. So these are small spheroid compressed tablets, 3 to 4 millimeter diameter. Then they have varying drug release characteristics. So each tuldok no kada isa anang kuan, kada isa anang beads diha naa sila lahi-lahi o kanang time nga ma-release. Okay? Maybe placed in gelatin capsule shell, then that gelatin capsule shell provide desired pattern of drug release. Okay, then the microencapsulation. So this process by which solids, liquids, or even gases may be enclosed in a microscopic particles by formation of thin coatings of wall materials around the substance. Okay, so what are these wall-forming materials commonly used to form a microencapsulation? Micro because you cannot see a capsule. Okay, makita lang nimo na under the microscope. That's why micro. Nagagmay kay ni sila. So, common ginagamit na wall-forming materials are your gelatin. Pero you can also use the systemic polymers such as your polyvinyl alcohol, ethyl cellulose, polyvinyl chloride, and other materials, no? That can be used. Ang kani siya. That's the shell. So muna siya ang atong ginatawag nga micro encapsulation. Then these are the active material. Ginakuan niya, ginasulod niya. Pero gagmay kay ni sila. No, you cannot see this with your naked eye. So dissolve wall material in water, add the material to be encapsulated. So for example, first step in doing this microencapsulation, na kay gelatin imo tunawon sa water. And then pag tunaw mo sa water, i-add na rin nimo tong imuhang, for example, liquid, no? Pwede daw ka mag-add og liquid. For example, nag-add ka og liquid. Then nag-form siya og duha ka phase, the two immiscible kana siyang phases. Again, ngano na ito immiscible phases in your FEFARM because of their surface tension, ilahang surface tension, no? So, ang buhaton nimo, you steer na two phases, no? Pag mag-steer ka, remember that steering, no? Sa inyong FEFARM, the steering can disturb the surface tension and decrease the surface tension. Muna murag, pag mag-steer ka gani, mura silang mag-homogeneous, pero pag once nawala na ang force nga imong i-exert, magkuan na pod sila, mag-separate. However, diri sa kaning imong gibuhat na microencapsulation, pag steer nimo, di ba mag-steer naman ka nya, mura sila mag-form og mga droplets. Kabantay mo kanang magkuan mo, water nya patakan ninyo og oil. Nakatry na mo kanang water and oil, di ba? To immiscible man na sila. Example, so pag imong steer, di ba, mag-form siya og globules, kanang mga goblets. So inana ang buhaton, mag-form siya goblets. And then katong goblets na yang i-form, atong gelatin adto, iyang i-coat, no? So kada steer nimo mag-form siya og droplets, dayon ang gelatin iya atong pang coat, i-coat niya tong mga droplets. So atong droplets, remember na dito ang imong active substance. Okay? So mo nang microencapsulation. So advantage of this kuan is administered dose of a drug is subdivided into small units that are spread over a large area of GI tract, which may enhance absorption by diminishing local drug concentration. Remember that the drug absorption of the product increases when there is an increase in surface area. Okay? So remember, kung gagmay ang imuhang particle size, taas ang dako ang surface area, then mas paspas sila ma-absorb and ma-dissolve. Next, no? Another example of a coating material or a technology that can provide extended release oral dosage form, your hydrophilic matrix system. So the inert plastic matrix, the complex formation, ion exchange resins, and then the osmotic pumps, or they apply the principle of osmotic pressure. Master naman kayo man ng osmotic pressure, right? So ang kaning imuhang hydrophilic matrix system, they slowly erodes in the body fluid. Then Once nga maghinay-hinay sila ang release, they progress, progressive na drug absorption. Okay, and then the hydrophilic cellulose polymer are used excipients in tablet matrix system. You can also use the hydroxypropyl methyl cellulose, a free-flowing powder commonly to provide a hydrophilic matrix. Okay? So for the ion exchange, they contain a resin, forming a complex by the placement of hydrogen atom. So kani siyang ion exchange, they release in greater acidity of the stomach but in less acidic environment of the intestine. And next is the pump. So ang pump ani, if you can see the example in your book, katong picture na ay, di ba na siya 2 layers? Sorry. Ano itong drawing sa inyong book? Something na ay duha ka layer, ana. Okay? Dayon, dili mo gawas ang tambal. Dayon, dili mo sulod ang tubig. Okay, who can explain to me the principle of osmotic pressure? Or what is the principle of osmosis na lang? Unsa man ang osmosis? It's the transfer of
movement of molecules.
Sige. Si Sikalan. Sikalan ang unang pop up. Sige. Mr. Sikalan, unsa ang kuan? Unsa ang
Movement of molecules sa kanang semi-permeable membrane from high to low concentration of solute.
Unsa to? Movement of
Molecules in a semi-permeable
molecules.
membrane. Solvent molecules, ma'am.
So, unsa man gyud? Si solvent, si molecule.
Molecules, ma'am.
Si molecule ang move. Okay?
Yes,
Sige
ma'am,
daw.
across a semi-permeable membrane.
Sige. Thank you, Mr. Sikalan. No? So, ingon si Mr. Sikalan, osmosis is some movement of molecule. Ang sa nga molecule, ang solute, the solute, no? From higher to lower concentration, lower to higher.
Lower to higher solute concentration, ma'am.
So, kasi mag-move, the solute or the solvent? Okay. Sige, back to basic tabi. So, ito inyong osmosis gani. Sige, research na yun. Sa itong meaning sa osmosis? Sige, sa itong meaning sa osmosis? Diba? Osmosis is the movement of solvent. Okay? From hypotonic to hypertonic to achieve equilibrium. Di ba naman nasa yung biochem? Again, ang solvent ang mag-move ha, ang water molecule ang mag-move. Okay, for example, sa kanina A and B. Sa column A and column B, aha man ang hypotonic, aha ang hypertonic. Madunggan ko?
Yes, ma'am. Yes, ma'am.
Sige, aha man ang hypotonic, aha ang hypertonic.
A ang hypotonic, ma'am.
So, yung B din ang hypertonic,
Hyper din ang
ma'am.
Wait. Hypo. Sakto? Sakto na. Correct. Now, this is a hypotonic, meaning mas lower iyang solute concentration than the hypertonic. So in osmosis, the pressure, okay, the pressure, akaman padulong. Padulong sa tuo or padulong sa wala?
Mag- from lower to high, ma'am.
From lower, so from diluted to concentrated. So mo man yung diluted, right? Diluted kay mas daghan ang solvent than the solute. Okay? So, kani siya ang B, mo ni siya ang mag-create og pressure. Mo siya ang mag-create og oncotic pressure. Meaning, birahon niya ang tubig paingon dinhi. Again, water or solvent movement from higher solute concentration to lower solute concentration. Kay gamay raman ni siya og solvent than solute para ma-achieve ang equilibrium, meaning ma-achieve nimo nga the same silang concentration, ipa-move niya ang tubig dire sa A paingon sa B para kaning B ma-dilute. Okay? Para mapariha ilang concentration. For example, kani 50% ni siya. For example, 50%, nya kani 100%. Okay? Ayang concentration. So, birahon niya ang tubig, no? Birahon niya ang tubig paingon sa iyaha para magpareha sila og concentration nga 50%. So, ma-stop lang ang imong pagbalhin sa water from A to B if they achieve the equilibrium. Okay? So, sabta ng osmotic pressure. So, ang magbira og solvent katong daghan solute. Again, ang magbira og solvent katong concentrated, katong daghan solute, katong hypertonic. Okay? Birahon niya. Tabdan?
Yes, ma'am.
Okay. So, inana ha, para mabalance siya. So, ang nahitabo din sa atong osmotic pump, no? Kani sa osmotic pump nato, concentrated ang sa sulod kay naaman siya daghan solute. Okay? Concentrated sa sulod. So, magkuhan siya tubig, magbira siya tubig, yung birahon ng tubig. Wait. Again, naay dalan di ano, nadiri ang katong mga tambal sa sulod. So, ang water, pasulod ang water. Because, again, mas concentrated ang sulod than the outside. Okay, birahon niya. So, katong pressure, no, it will create a pump. So, kung mapuno na nagtubig, mo siya ma-squeeze. Okay, mo siya ma-squeeze. Kay mapuno man og tubig din ni, ma-squeeze. Pag kada ma-squeeze, no, mugawas ang tambal. Okay, that's the mechanism of your osmotic pump, no, para sa extended release oral dosage form. They apply the osmotic pressure. So, magkuhan sa tubig, no, iyahang ko ipasulod ang tubig. Katong tubig ang mag-serve as a pressure para mugawas ang tambal nga nasa sulod. Nasabtan? So, that's the principle of osmotic pump, no? They use osmotic pressure. Next, the delayed release oral dosage form. Intentional, so they have intentional delay until it reaches the intestine. They protect a drug, no, from being destroyed by gastric fluids. They reduce gastric distress. They facilitate GI transit for better absorption. Example again, the enteric-coated, which is pH dependent, meaning dili siya mo release sa drug niya kung napa siya sa stomach. Dito pa siya mo release kung maabot na siya sa intestine. And then the drug nimo, it takes time, no, to reach your intestine. Time dependent, kay calculated na in a healthy person, given nga wala kay sakit of motility, after 2 hours niyo pag-inom, ay pa siya mag-release og tambal. And enzyme dependent also. So these are the modified release tablets and capsules official in the USP, no, the delayed release and then the extended release. Just read that in your book. And these are the proprietary modified release oral dosage form, the dosage product and manufacturer and their characteristics. Again, dili barato ang paghimo ani because it needs expertise, it it needs special materials para mahimo. So expected na dili tanan manufacturing company can make, no, can have the liberty to make a kanang inana ka convenient na dosage form. So for the reading assignment, just read the USP requirements and FDA guidance for modified release dosage forms, clinical considerations, packaging and storing modified release, pharmaceutics case study, and clinical case study. I will give you a choice, no? If we will include this topic sa Sabado or ako na lang na siyang insert diretso sa exam. Which one do you prefer? Ako kay appeal sa quiz the Saturday kaning topic or ako na lang ni siyang i-appeal diretso sa inyong exam next week? Sige. I will also solicit kana siyang idea, no, or kanang suggestion from other block later, or I will announce and then you make a decision as a whole, then inform me before ang Saturday. Yes, you can have a poll, no, mag-poll na lang mo dito sa kuan. Later na kay magklase pa man ko sa C&A later 5 to 6. So after nila og klase ay hadalan mo mag-decide. Okay, as a group. So ana lang, majority wins na lang ta. Mas gamay raman po ni siya na topic noon compare nimo sa katong uban. And then this coming Saturday, I look at the kuan man god, gitan-aw na ko ang coverage sa exam, taas na kaayo. Ika-upat na nga chapter, right? Na-count ako
Yes, ma'am.
na-count ako isa ka kuan pero murag basig mga buyong na mo din ako i-appeal. Okay? So tama na diri ang ato ang coverage for the exam. Din ako mag-lecture sa Saturday. Okay? Para katong nabilin na topic sa semi na lang o sa finals. Kitanaw na ako ang coverage murag yung kuan. Na po'y makatulog nga di maka-exam. No? So ana. Ha? Pero ang decision nasa inyo ha. Kamo mag-decide. I will just give the kuan na lang sa inyo ha. Ang option na. Okay? Any questions? Clarifications?
None, ma'am.
Wala
None
na.
naman.
Wala na. Okay. So if there's none, class dismiss. Thank you.
Thank you, ma'am.
Thank you also,
Thank you,
ma'am.
ma'am.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.